Good morning, welcome to my day. It is a big day today with a lot of stuff going on. I literally just woke up, it's 5:30.
What Meniere's disease is an inner ear disease that causes progressive sensorineural hearing loss in addition to violent rotational vertigo. Other symptoms can be tinnitus, which is kind of this roaring or hearing sounds, a pain in the ear, fullness. Often you'll see me yanking on my ear. I have Meniere's in my right ear. People can have it in one or the other. Vertigo is very debilitating. Vertigo is a hellish thing. It is so hard to understand vertigo unless you've had it. It's not dizziness. You can't even use that word in describing vertigo, except for there's really no good words to describe it otherwise.
The dogs are still in bed. Benny, let's go. Go get you on your treadmill. So we get up so Benny can get on his treadmill, but actually what I do before that.
It is a really, really horrible thing, and if you go through Meniere's disease or vertigo, my heart just goes out to you. Know that you are not alone. It is a very, very hard thing to deal with. Sometimes all you can do is just keep putting one foot in front of the other and just get through the next minute.
I am going to straighten my hair. You can see I've got curl in my hair, which actually I really like, but it's hard to maintain it. I'm gonna get the flat iron out. I could curl it, but I'm just not awake enough for that. Maybe I'll plug both of them in. Plug that in, plug this one in, we'll see.
I was diagnosed with Meniere's disease back in 2010. It was very unexpected. I did not expect that I was gonna have any hearing loss. I've always had excellent hearing. Ever since I was a child, my nickname was radar ears. So the fact that I had mild hearing loss was a shock to me, and I was sent to see a neuro-otologist, which is a specialist. He's basically an otolaryngologist or an ear, nose, and throat doctor who specializes in treating the ear. Neuro-otologist, the O-T-O, Odo, which stands for ear. That doctor started to help me with different treatments.
Stand. Let's go. She's like, I'm sleeping. Hi Dash, let's go. So you can see I brought their food in here and fed them. Okay, stop. Dun, da, da, da. Benny, look, jump on. Good morning, Mama. I'm taking off his collar so that he will not get it caught while he's walking. Good boy. Sweet. Good boy. All right, I love you. I tried to do a good morning love.
The first invasive treatment that I had was a steroid injection. It was extremely painful and it didn't help me at all. And I didn't want to try it again. I was definitely not liking that. The next treatment that I had was an endolymphatic sac decompression surgery. I did not have a shunt. If you're wondering what that is, I can explain it into another video. Just ask. Basically, I had that surgery. It had a 50 to 60% chance of helping, but at that time the vertigo was so debilitating I didn't know how I was going to keep getting through each day. I was definitely ready to try something that was extremely invasive, and I had that surgery in the end of March of 2011, and I went into remission. My Meniere's disease went into remission, and I was completely vertigo free until 2013. I started to have some experiences, but it really wasn't until the end of 2014 in December where Meniere's came back with a bang and I was completely debilitated, bedbound again. It was a nightmare. I was very thankful, and it was absolutely worth it for me to have had that surgery. I'm so glad that I did it.
So I'm going to hit start, and that was stop. I'm not awake. I'm really not awake, sorry peeps. Benny goes for 3 miles an hour, and I slowly work him up to that, just like anybody would. And I do it for 30 minutes. So he is at 3 miles an hour. Good boy. Here's the living room. These are fake flowers, actually. They're really pretty, but I got them because I wanted to get a pop of orange because I love orange, and I thought it would break up all this turquoise and blue really nicely because I love that rust blanket. Is super soft. It's the softest blanket I've ever had. And then I got these pillowcases, which they don't quite fill out inserts I have, so I might get some stuffing for them, but I really love this carpet. I feel like it matches the color. I was trying to match the color on this, and that's what I did with these. I just got got those to match this, and I got this to match this, and I also like that this has some blue, which brings out the blue in the thing. That is when I went back and started to see my neuro-otologist again. We decided that after I did the balance testing, the V&G testing again, we decided that gentamicin would be the next treatment that I would try. I had my first one in October of 2015. Usually people only have 1 to 2 gentamicin injections, and they're vertigo free. They never have vertigo again or Meniere's attack again. That was not the case for me. It would help for a period of time, and then my vertigo would come back, and it was maddening. There are patients like me out there that this does happen to. Eventually, we're hoping that it will completely destroy all of the function that is related to the balance center of my ear. We call it the vestibular center. Vestibular functioning. We want the vestibular functioning to be completely zero. And that's what the gentamicin, which is an injection of medication in the ear, is hoping to do, to completely destroy the vestibular function in the offending ear. Mine is my right ear. I had 5 of those. The last one was in April of 2019. And while it was hopeful, I didn't notice anything. I don't know that it affected me at all. I made some food in my bag last night, so I'm all ready for that. Let's go, baby. Good boy, Ben. What a good workout. Just hit 30 minutes, and I'm gonna slowly slow it down for him. So I go down a little, let him get adjusted here. Good boy. Good boy, beloved. Good boy. When I moved, obviously I needed a new neuro-otologist, and I went to one that my old neuro-otologist had recommended in Vanderbilt. It was a nightmare of an experience. This doctor didn't listen to the treatment I had done. He didn't listen to my full story. It was like it didn't even matter that I was there and needed help. It was a nightmare. And so thankfully I got another recommendation for a doctor that treats only Meniere's patients in Nashville, and wow, it was really, really exciting because this doctor got me. He knew me, he understood. So what I do the night before I'm going anywhere, usually I do it every single night, I actually hang up clothes that I think I might want to wear. So I have a pair of jeans, and I have 2 t-shirts that I can choose from, and this. I really, really like that I have that done, because sometimes in the morning I just can't think. This is really funny. The whole purpose of coming into the bathroom earlier and showing you all plugging in the curling iron and the flat iron was to get them warm, so that by the time I come back, they're warm. Well, I forgot to turn them on. So, oh, actually this one's always on, so never mind, that one's on, but this one isn't. That is so funny. It is what it is. He wanted me to come back for testing, so that first time I videoed a lot more than the video that you actually saw, but unfortunately my drive got corrupted, so all of that video is lost. Basically, I was just so over the moon with this doctor and so thankful. He really got me, and he understood, he validated, he looked into my eyes, he saw the problems that you can see with balance when you look into somebody's eyes. He had me walk, and he saw the deficits when I walk. I pulled to my right. Often when I have Meniere's attacks, I get forced asleep, and that is called Sopite Syndrome, which it was wild that he had a word for it, because I've always felt a little crazy that whenever I get a Meniere's attack, I can't stay awake. It's like, what's going on? But apparently my brain is so overwhelmed with the vertigo, it can't keep functioning with me awake, so I have to go to sleep, which is wild. It was just really validating to see that doctor, and also exciting because he had a plan. Usually when I get ready, I listen to an audiobook, which right now I'm listening to Julie Klassen's The Bride of Ivy Green, which is 3rd in a series. It's inspirational historical fiction. All right, I gotta change. I'll see you in a minute. Snap, so I think I've decided I'm gonna curl it. Here we go.
Well, I gave you all my love, and I gave you all my trust, and I gave you everything that you need. But you only told me lies, and you made me realize that, babe, you ain't no good for me. I can't be with you, you can't be true. And I know this.
So I have to hurry up because I have to groom Benny too. Didn't expect to take this long doing my hair. Look at all these curls. unfortunately, one of the medications I take for my psoriatic arthritis, methotrexate, is thinning my hair. And I've lost a lot of hair because in higher doses it's a chemotherapy drug. Thank goodness I don't need it in higher doses because I would lose my hair even more. It's really thinned out. Most people can't tell because they don't know what my hair looked like before, but if I went off the drug and I regrew my hair, you would be able to tell.
Well, you're begging me to stay, but I'm going my own way, and the skies ain't looking cloudy or gray. I won't even roll the dice so that you can't play me twice, no babe. Who do you think I am?
So I'm running really late. I'm not going to be able to address the camera anymore, or I'm going to really be running late, but I'll show you what my hair looks like.
Well, I'm gonna take my own road.
I get brushing my teeth and see on the flip side.
And so I came back 8 weeks later and did some testing, and that's when I got the first steroid injection. And then I came back expecting to have a gentamicin injection because even though I'd had 5, the last few didn't seem to really help at all. I think this doctor wanted to do it himself, and he wanted to see himself because the gentamicin is a lot less invasive than another option that we have talked about.
Oh, right, even if it's passenger tire.
When I was there last time and I had the steroid injection, he was doing it just to see how it was going to help. We didn't know, and I really didn't want to try it again because it was so unhelpful before. I was extremely shocked when I got home, and after a few weeks, I started to notice my vertigo had improved. I could not believe it. I really could not believe it because I didn't expect this to help at all.
So we are in the room. This is one of the rooms. We're talking to Dr. You don't know for sure if I'm getting the injection or not, but we're gonna talk about it anyway. See what happens.
So when I was going into this doctor appointment, I was expecting to get the gentamicin because he wanted to see how the gentamicin was gonna help. When I went back to him and I said things have improved, I still was having some Meniere's attacks here and there, but they were significantly different than they were before. So he said, let's do another one.
So we're getting steroid instead of gentamicin. So here I am in the chair and I'm about to get a steroid injection. It's similar to a gentamicin injection, just a different medication. So Benny's on this side, he's gonna be here, gonna lay me back, do the injection. I lay here for a little bit and then we go home. I thought it was gonna be gentamicin, which I've had 5 times. I've had a steroid 3 or 4 times and I had it in January, so we're gonna do it again and see how that works and hopefully give me more vertigo relief. We hopefully believe that the steroid has done something last time. We're hoping it'll do something this time. Really excited to get this done. He'd like me to do oral medication of steroids, but because of my migraines, I can't. And I'm gonna try a new medication for nausea. It's usually for cancer patients. It's to reset the brain. It's called Emend. Usually nobody gets prescribed it. He says he rarely gives it to people, but sometimes there are people who need it like me. That's the way it goes. Hopefully this will
be helping me long term. The thing with the steroid injections is that right now it's an effective treatment for me, and I'm really excited about that because it really is taking down the vertigo. It's not a permanent treatment, and unfortunately this doctor said that in his experience it doesn't last. While I can continue to go in and get injections, at some point my ear won't tolerate it anymore and it won't respond anymore. I am not going to live there. I'm going to live right in the present and be really thankful that it is helping.
Hey guys, so this is the ear and this is what I'm having done. So this is the ear, my right ear. I'm going to have a needle go in here, go through the eardrum, the tympanic membrane, inject medication into that space, which is the middle ear space, and it'll be absorbed into this organ right there, which is called the cochlea. Bigger view of the cochlea is right there. And the cochlea is the inner ear, and this is the hearing part, and that is the balance part. So we're wanting the medication that we're injecting to affect this part, which is the balance portion of the ear.
Steroid injection, it is working for me right now. Truly a miracle in my mind that it is, but I'm very thankful for every day.
He's just out. It's so funny. So the doctor's gonna be over here, so he's gonna be out of the way, but he's just taking up as much space as possible, which is per usual. So funny. And then Mom is my cheering section over there. She's rooting me on.
Benny really helps to ground me, and my neuro-otologist nicknames him Propy, short for proprioception. Sorry, I always have a hard time saying that word. And I'll give you the definition. It's basically knowing where you are in space, and with Benny's 4 paws solidly on the ground, I can feel the ground through Benny, and it's amazing feeling when I'm holding on to him. When I'm walking around with my cane, I don't feel like that. I don't feel secure. I kind of feel like I'm floating when I'm walking around. I basically use a cane all the time. I can walk around with my cane without Benny, especially in my house. My house is predictable. I know where the places are that I might fall. I know where the rug is that it bumps up. I know where I wouldn't be safe, and because I live here, I'm used to that. But in public, the environment is not predictable, and so my balance could be thrown off very easily because I didn't predict that there was going to be that rug there that I could trip over, or that the part of the floor is going to be tilted a little bit and throw me off and make me feel like I don't know where I am, or maybe all of a sudden it goes dark and I rely heavily on my eyes to balance. I need to be holding on to Benny to keep me upright. I still very much have balance problems, but the vertigo has improved, and I'm so thankful for that.
I've never known a love so steady. Even gold won't turn your tide. We flow together like an ocean.
Really hurt.
Every low and every high.
Looking forward in the future, if and when the steroid injections stop working, basically what we'll do is do a gentamicin injection to see if that can help at all. If it doesn't, if it fails, that is likely when we will then go to the brain surgery, the nerve resection, which is a very invasive brain surgery. This neurosurgeon and my neuro-otologist would go into my brain and sever the connection, the nerve between my balance part of my inner ear and my brain. It is effective, but there are a lot of risks, and there's a lot to take into consideration when considering brain surgery. It's a really heavy thing, but having gone through everything I have in my life, it's a place where I'm at, where I'm ready to do that really big decision. We'll talk a lot more in depth about it. It definitely is on the table.
I just had the injection. My ear was a lot more painful than I had last time, probably because I have a migraine. My brain's all sensitive right now. Hurts to talk, so I'm not gonna.
So where I am right now is that the brain surgery option is on the shelf because we're not there right now, and we're going to continue to do the steroid injections until they stop helping. If you guys have any questions, please ask them in the comment section about Meniere's, about the treatment, about my experience. Maybe you have Meniere's disease, you've been going through things. If you have questions about what you've been going through, maybe you just want to vent about what you're going through, you want somebody else who knows what it's like, you just want to vent about it, I'm here. It is very hard to go through through any health issue that's debilitating. Meniere is very, very hard, and I'm so sorry if you have to go through it. And at the same time, I'm rooting you on because you can do this. Just keep putting one foot in front of the other and keep moving forward. Keep positive, keep fighting. There is hope. Thank you guys for watching my video. The next video is so exciting. I'm really excited to share it with all of you. And I'm gonna start crying right now. Yeah. Guys, you matter. Don't ever forget that. You matter. I forgot that for a really long time. I don't want anybody who watches my videos to think that they don't, because you do. You are enough just who you are right this second. I am Kelly, and you are not alone. I will see you in my next video, guys. Bye. Love you so much. Just vertigo and oh well. It's part of it.
Used to think I had to do it on my own, but I'm never alone now.